All right. Thank you. Good afternoon. My name is Lynette Rhodes, and I am the Executive Director of the Medical Assistance Plans Division. And this session will focus on Medicaid and CHIP redeterminations and the end of the continuous enrollment requirements. So we'll dive right in. For those of you who were able to attend the opening session, you heard me speak about our current enrollment trends, but I wanted to just touch upon this for those who were unable to attend the opening session. As of March the 31st, our current enrollment is 2.8 million members. This consists of Medicaid and Peach Care for Kids members that we are serving today. As you can see from this slide, this represents a significant increase in enrollment as compared to March of 2020. So at the time when the public health emergency was declared, our enrollment in the state of Georgia was 2.1 million members. So over the past 3 years, we have seen an increase of approximately 700,000 enrolled members. This is due to the fact that at the start of the public health emergency, state Medicaid agencies were instructed to maintain enrollment for Medicaid and CHIP members. So over the past 3 years, with certain exceptions, we have maintained all of these members on the rolls, in addition to those members who would have submitted new applications during this period of time. So I want to talk about what is happening now, effective as of April 1st. We are now beginning to conduct redeterminations for all of our enrolled members. And so your first question may be why? Why are we embarking upon this task? And what is the ultimate end goal? So as a starting point, all state Medicaid agencies were directed pursuant to the provisions of the 2023 Consolidated Appropriations Act to begin to conduct Medicaid and CHIP redeterminations. And that is because over the past 3 years, we've not verified eligibility for any enrolled members. And again, this was a directive and a result of the public health emergency. So starting on April the 1st, we in the state of Georgia began conducting Medicaid and Peach Care for Kids redeterminations. And so we're now looking to confirm that our members that are enrolled are in fact eligible to receive services in the state of Georgia. This process will take us approximately 14 months to complete. Each individual member will be determined and will be reviewed to determine whether or not if they're eligible for Medicaid. Not every member will go through this process at the same time. It is important to note that each member will have a particular month in which their redetermination will occur. And we are going to align their Medicaid redetermination with other public programs such as SNAP and TANF, such that if a member has a redetermination date or a renewal date for either SNAP or TANF, our intent and plan is to conduct those at the same time. On this particular slide, we want to demonstrate for you the timeline in which this activity and these events will occur. So as you can see here to the left, in the month of April, that is our first month in which we will begin initiating the renewals or redeterminations. And pursuant to federal guidelines, the states have 14 months to complete this process. Thus, we must be complete with all redeterminations by May of 2024. That gives us exactly 14 months to complete this process. What does the member renewal process look like for our Medicaid and CHIP members? There are two processes that will take place. Number one is what we're calling an auto renewal process. That means that we as the state are able to determine their eligibility based upon information received from external sources. So for example, the Department of Labor, the Internal Revenue Service, asset verification system. So members who are auto-renewed will not have to provide any information because the state of Georgia can access all information needed from those external sources. If a member is auto-renewed, again, there's no action required on their part. We will complete the process and simply issue a notice to that member informing them that their eligibility will continue for another 12 months. In those instances where we are unable to obtain all of the information needed to complete a renewal or redetermination, we will send to that member a renewal notice. That notice will be sent via mail or via email, and that notice will inform the member of the ways in which they can go in and complete the renewal or redetermination process. So a member can do that in one of four ways. They can go online to the Gateway website, and I have listed for you here that particular web link. The member can also call the 1-800 number and get assistance with completing their renewal. They can appear in person at a local DFACS office, and we've also included a website which lists the various locations and the hours for each of our DFACS offices. Or they can request a pre-populated form that we will send to that member in the mail, and that member will complete that form and return it. So those are the four ways in which a member may complete the renewal process. In terms of the timeline, again, we begin this process on April the 1st. And again, this will run for a full 14 months. For those individuals who were not able to be auto-renewed, the notices were issued on this past Monday for those persons who have a renewal date in the month of May. And so I just want to remind everyone that this is going to be a 14-month process, and each individual is assigned a particular month in which their redetermination will occur. So each month, starting now, we will issue notices to those members who have redetermination dates coming up. It is important to note that the earliest termination date will occur in June. So in the month of April, no members will be terminated. Again, here we're focusing on auto renewals for the month of May. And then for those who are not able to be auto renewed, we're issuing notices to those members so that they complete the redetermination process in the month of May. If we determine that the individual is no longer eligible for Medicaid or Peach Care for Kids, they will receive a notice of denial or termination at the beginning of June. So that again will be the earliest termination date. For those members who are unable to provide the requested information by the end of the month, those individuals will have a 90-day reconsideration period. So that means 90 days after the denial, that individual can submit information to the state of Georgia for their consideration. And again, members who are denied have the right to appeal that decision. We've provided for you here an example of the timeline, and this applies to each month, but we're just using the month of May as an example. So for those persons who are not able to be auto-renewed, we will issue a renewal notice in the mail and email. Again, that notice will typically go out 45 days in advance of the end of their service period. If we do not receive a response from the member, we will send a second renewal notice as a reminder. We will also send out a verification checklist if additional information is needed for the member. And we will send out a notice of decision closing out a case. And so this is for persons who are approved or for persons who are denied. And again, you can see here the reconsideration period in which a member can provide the additional information that is needed. I want to talk about the pathways to coverage waiver. And I touched upon this in the opening session this morning. And for those of you who registered for the pathways session, you would have also heard from Anika Washington. So the importance of pathways is that it goes live on July 1st of 2023. That is our projected go live date. And again, the Pathways program is designed for individuals ages 19 to 64 who have incomes up to 100% FPL. These individuals will be required to meet certain qualifying activities, and again, they must opt in. The intersection with the end of the continuous enrollment requirements is something that I want to spend a little time on today. So there will be some individuals who will be deemed ineligible for Medicaid or Peach Care for Kids. However, some of those individuals may meet the qualifications for the Pathways waiver. So this waiver will actually serve as a safety net to be able to come in and provide coverage to some of those individuals who are no longer eligible based upon the current Medicaid and Peach Care for Kids eligibility requirements. So we are attempting to identify those individuals who we feel would be eligible for the Pathways program. We are going to delay their redetermination date until after the Pathways waiver goes live. We will then reach out to those individuals and inform them about the Pathways to Coverage waiver and allow them the opportunity to opt in to the program. So again, we just wanted to point out the intersection between the Pathways to Coverage waiver, and again, this is an 1115 demonstration waiver that we've received approval on from CMS, but just wanted to demonstrate the intersection between this waiver and the end of the continuous enrollment requirements. So why does this matter to you as a provider? And how does this impact you as a provider? Just as these are our Medicaid and Peach Care for Kids members, they are also your patients. So these are individuals that you provide care to on a daily basis, whether you're a primary care physician, whether you're a hospital, whether you're a DME provider. You treat and see these patients, these Medicaid and Peach Care for Kids members on a daily basis. As we go through the redetermination process, there will be instances in which a member is deemed ineligible for Medicaid or Peach Care for Kids. As a rendering provider, it is imperative that you verify eligibility on each date of service. For providers that have received prior approval to render services, you are also required to verify eligibility on the date of service. If the member is not eligible on the date that the service is rendered, the provider will not receive reimbursement. So I want to emphasize the importance of verifying eligibility each time a member presents at your facility or your office. We've listed for you here the ways in which you can verify eligibility. You can contact the provider contact center, and we've listed the numbers here that you can call. You can also log on online at www.mmis.georgia.gov to verify eligibility on our MMIS system. Or you can submit electronic request for eligibility verification through your clearinghouse. In terms of communications, I want to share with you all some websites that we have developed that contain a host of information about the Medicaid and CHIP redetermination process. Several months ago, we developed a website called staycovered.georgia.gov, and that is the first link that's listed here on the current slide. Under this particular website or on this particular website, you will find frequently asked questions. You will find a provider toolkit. There are videos and other resources that provide information that you will find valuable as a provider. In addition to the Stay Covered website, the Department of Human Services also has established a Medicaid unwinding page. And again, we've provided that link for you here. So I strongly encourage you to visit both websites and to review the information that's posted. We are collaborating with a number of provider and member associations. So if you would like for us to come and speak to your membership, if you're a provider association that's attending, please reach out and we can coordinate that. We've done a few presentations thus far with some of our larger provider associations. For example, the Georgia Hospital Association and Hometown Health. And so we are ready and available to provide similar presentations to your particular associations. Whether that's virtually or in person. It is critical and imperative that we have your assistance in this process. Again, these are our members, but they're also your patients. And so we have a collective and very similar goal, which is to keep members enrolled in the Medicaid and Peach Care for Kids programs. We are posting banner messages regularly. We encourage you to attend our board meetings that are held monthly, as well as any other committee meetings, because throughout the next few months, we will continue to promote and to discuss the Medicaid and Peach Care for Kids redetermination process. Additionally, our care management organizations are going to play a very vital role in this process. Our care management organizations are aware of the redetermination dates for all of our members that are enrolled with the CMOs. So they will be doing direct outreach to our members. They will be posting information on their member web pages. They will also engage in texting campaigns. So to the extent that you can help with that process, we would greatly appreciate it. So how can providers help? Number one, you can notify your Medicaid and Peach Care for Kids patients that the redetermination process began on April the 1st. We recommend you do this when a patient checks in at your facility or provider office. And the way that you can do this is by handing them flyers, or just giving them information about the redetermination process that you again can obtain from the staycovered.georgia website. We're asking providers, if they can, to provide text messages or send text messages to members, to make direct phone calls, and if possible, to also send emails. For the second point here, it is imperative that you remind your patients to update their contact information. That's critical. That's how we're able to reach our members. I do want to share with this group, if you will recall, several months ago, Governor Kemp issued an initiative. It was a $350 one-time cash payment to help encourage and incentivize members to log into the gateway system and update their contact information in preparation for this redetermination process. For those members that have not gone in to update their information in the gateway system, that $350 one-time cash payment is still available to them. So if you can assist in spreading the word, that would be greatly appreciated. And again, to the extent possible, assisting with the redetermination process. So I'm going to open up the floor for any questions or answers that you may have, and we will take those now. I believe that we've already received one, And the question is, will the next Medicaid Fair be virtual or in person? And so I am excited to announce that our next Medicaid Fair, which will take place in the fall of the year, will be in person. So we are working internally now to identify the dates, the times, and the locations. So please stay tuned for more information regarding the upcoming fall Medicaid Fair. And I'll pause now to see if there are any other questions. And we encourage you to raise your hand so that you can be acknowledged.
And Lynette, we do have one in the Q&A box.
Okay.
It says, it's from Amber Poss, LPC. It says, will Medicaid providers need to do anything additional to provide services for individuals under pathways to coverage, or will there be an additional contract?
So, very good question. So the Pathways members will receive the same benefit package as any other enrolled Medicaid member that's enrolled with our care management organization. So I think as a starting point, I'll note that the Pathways members will be enrolled in managed care. So they will, they can select which managed care entity they would like to enroll with. Today, that's AmeriGroup, CareSource, and Peach State Health Plan, but they will receive the same benefit package as a regular Medicaid member. The main difference here being that the Pathways members have to meet those qualifying activities. That's going to be the critical difference in terms of the populations. And our care management organizations are going to work closely with those members to try to help them maintain their coverage and make sure that they are meeting those qualifying activities.
Okay, so the next question is from Donald Washburn.
Okay.
Can you tell us exactly where on the website we can find the handouts we can give to our clients?
Sure. If you log into the staycovered.georgia.gov website, there are flyers that are available that can be printed down. There's a list of frequently asked questions. And I think the other thing that we can potentially work on doing through our Gainwell provider reps is to provide information to you all as well as needed. So we'll work with Gainwell Technologies and our provider reps to help to distribute materials as needed. But again, those can be printed down from the website.
Okay, and we do have a hand up from Patty Rivituzzo, and I'll go ahead and unmute you, Patty. You can go ahead and speak whenever you're ready.
Can you hear me now? Oops.
Yeah, we hear you fine.
Oh, okay. I have just a couple of questions. One is, with the expiration of the public health emergency, will providers be able to continue to provide teletherapy from their home? And I'm not sure if this is the right place, but I'm not sure where to ask that question earlier. We didn't get a straight answer on that, and we're really needing to know that. And I just wanted to also ask, with this process, like in that example that you gave, where you notify people April 15, then by the end of May, they could lose their ability to have Medicaid. So I'm wondering, is that going to be as of June 1st? And also with the 90 days that they are allowed to then come back to try to present whatever data, if they get, will they be completely discontinued and then potentially be set back up retroactively to June 1st, if that is how that works? I'm just trying to figure out for, what we might expect, that somebody won't be on Medicaid, but then they will be, and all of that communication of how will we know if they've come back on, if they were once disenrolled and then re-enrolled. Is it just up to the families to tell us, or just how is all that going to work? And one hope that I was going to just offer would be that it would be great if all the changes could be like on the 1st of the month rather than on the 2nd day of the month or the 15th day. And because it just is a whole lot easier. I know we're supposed to check every day, but it sure would be nice if all of our patients could be checked on the first day of the month, and that's how it used to be long ago, that changes only ever happened on the first day of the month, so we pretty much knew how we were covered for that month, or they would be covered for the month, and we wouldn't have to worry about suddenly a change in the middle of the month. So anyway, I'll let you answer those.
Okay. Can you repeat that? What? Mm-mm.
So I had the question about
Okay.
can providers continue to provide therapy, teletherapy from their home? And then the whole enrollment, disenrollment process.
Let me see.
Oh, you did here.
Yeah, can you summarize it for me? Can you summarize it for me?
I'm sorry.
No worries. Can you summarize it for me?
Sure. So the first part she asked was, is there going to be something for the providers to provide telehealth for the members at home? And she had a few other questions. Do you mind repeating the other
Next
parts? She had like
Okay.
3 or 4 parts of the question.
Okay, so for the part,
Here.
the
I
part
can hear
I'm
you.
wondering, I'm wanting to know about, will providers be able to continue to provide teletherapy from their home? Or do they have to come back into the office to provide teletherapy?
Oh, good question. So we are not changing the provisions that we put in place for telehealth. Can you hear
So
me?
yes, so they will be able to continue to provide teletherapy from their homes. The provider will be able to
Yeah,
continue
it
to
went
be
on.
at, the provider will continue to be able to provide teletherapy from their home.
Will the providers be able to provide teletherapy from their home?
Yes, we're not changing those provisions.
And then as far as when somebody is disenrolled, is it going to be the first day of the month?
Okay, I think we've got a plan here. Can you repeat that for me?
If a patient is going to be disenrolled from Medicaid, will it be as of the first day of the month, or will it be scattered throughout the month? And
Very good question. It will the first of the month.
and then if that 90-day period, they are able to provide data that tells you that they can be re-enrolled, will it go retroactive to that first day of the month when they were disenrolled?
Yes, ma'am.
And then for the CMOs where we need an author, if they happen to go off and then go back onto a CMOs, we have to have the authorizations. How will that all play? Will that all be worked out with them, that if we had a valid authorization, then it got, the patient was disenrolled and then they were re-enrolled retroactively, and we had an authorization in place, or we perhaps failed to get a new authorization because I'm hearing my feedback. It's hard to understand here. But let's say on the 15th of the month, our authorization expired. And then on the patient was provided all the data they needed to. You all came back and said retroactive to June 1st, they're set to go. But if they had one of the CMOs, we didn't have an authorization in place because they were disenrolled. And will all that be worked out to where there'll be some grace period, or?
So we will provide some additional information on that process. We'll put that in writing in FAQs that we're preparing now for our providers to outline what that process looks like. But I do understand your question fully, which is that what happens in a scenario where you have a member who you have prior authorization to render services to, that member starts out being eligible, but they lose eligibility. They go through the reconsideration process and then they're retro back. What happens with the prior authorization and what happens with the claim? So fully understand the question. We will outline all of that in our frequently asked questions and give very specific details on how to handle that particular process. And we will also work with our care management organizations as well to make sure that this is as seamless as possible process for the providers.
That's great. Thank you very much.
And we have another Q&A question. This is from Brianna Holland. She says, if Pathways is going to be a new waiver program, will we have to apply for waiver like we do all the other ones, CCSP, Source, Now Comp, etc., in order to be able to provide services and bill?
Dan, can you hear? So with Pathways, that member will opt in. There's no action required on the provider side. You guys will bill in normal fashion. So it's while it is an 1115 waiver, they're not treated the same as a 1915C waiver member. So for example, in our home and community-based service waivers, ICWP, Now Comp, CCSP, and Source, this is different from those waivers. So for 1915C for Pathways, these members are going to be enrolled with our care management organizations. If you're a provider already in their network, you would literally treat them the same as you would any other member, and you would bill for them in the same fashion.
And we'll go to the hands up here. We have a question from Deanna Jones. Deanna, you can go ahead and unmute your mic and present your question whenever you're ready.
Hi, thank you. Can you hear me? Can you hear me?
Yes, we can hear you.
Okay, great. I just want to clarify. So everyone on the redeterminations, everyone that has Medicaid at this point, every single person is going to go through redetermination, correct? Like there's no one that's exempt from this.
That's correct.
Okay, thank you.
Unmute.
Okay, there is a hand up from Jenna Guest. Okay. I'll unmute her.
Hello, can you hear me?
Yes. Okay, yes, we can hear you.
Awesome. I have two questions. The first is, where can we find more information about eligibility criteria for the 115 waiver, so we can determine if our patients may qualify for that waiver? And my second question is, we're seeing members who are losing Medicaid coverage currently. So they're losing low-income Medicaid in February and in March. Should that be happening? Why would they be losing coverage right now?
We'll need to look at that. If you can send examples to me of those individuals, then we can take a look at that. But that should not be happening as we've just started the redetermination process. So that sounds like that may be an error. So that's something we need to look at. And then in terms of the qualifications for Pathways, really very simple. Individuals ages 19 through 64, up to 100% FPL. But I think the challenging part is going to be the qualifying activities. And so once we get a little closer to the July 1 date, we are going to issue some communications, frequently asked questions. We're actually working to finalize those right now. That will give more detailed information on all of the eligibility requirements for Pathways members. So stay tuned. We're finalizing those FAQs right now.
Okay, thank you.
So there's a hand up from Ralph O'Connor. Okay, did you unmute?
There, I think it's unmuted. Okay. I'd like to piggyback on the last person. I work with a very small safety net clinic, and we've identified at least 30 of our patients who have lost CMO Medicaid coverage in the last year. And I have reached out through GAMUS with some of them and to the CMOs with the others. I'd also like to compliment you all for coordinating the Pathways rollout with the redetermination. That sounds like a winning process. One question I have about the Pathways is what I saw on the website among the qualifying activities were higher education. And I thought that was taken out of an earlier draft because it seems that would make every college kid in Georgia almost eligible. Did I misread that?
It is still one of the qualifying activities, sir. It has not been removed. And so again, remember the point of this is to try to expand coverage to as many individuals as possible who meet those qualifying activities in the state of Georgia. So yes, we fully anticipate that there will be, college students, that are currently enrolled, as long as they meet those requirements and those hours, then they should be able to receive services. And remember, they have to continue to meet the qualifying activities throughout the duration of their enrollment. So it's not just checking at the beginning when you first enroll. We will be verifying their eligibility every month that they're actually receiving services throughout the duration. So I hope that answers the question, and thank you very much for the compliment on pathways. We tried to make sure that there was an intersection between the two and that it could serve as a safety net for those, who qualify, who may be being terminated.
We do have one more hand up from Christine. And Christine, give me a moment and I'll unmute your mic. Okay, go ahead. Can you hear us?
Yes, I can. I'm trying to find on the portal the Part 1 policy and procedure manual for the codes that are showing inactive plans, but I don't see it on mine's. Can someone help me with that?
Christine, can you speak a little louder? We can't hear you.
Can you hear me now? Hello?
That's better. We can hear you now.
I'm trying to find the Part 1 where it's policy and procedure manual for codes, but I don't see it on the portal where I'm looking at. Can someone help me find that?
Sorry. So all manuals are placed on the GAMIS website.
I'm on there.
www.mmis.georgia.gov.
Yes, I'm there.
You will select the provider tab.
Yes.
And then provider manuals.
I'm there.
And you will see the listing of all of the manuals. They're in alphabetical order.
I see it.
On page 2.
Okay.
You'll see Part 1 policies and procedures.
Okay. Thank you so much. Okay.
Okay.
Ralph O'Connor's hand is up. Ralph, do you have another question?
Just a suggestion, not to make your process more complicated, but when you don't hear from any of the Medicaid members after your 2 contacts, is it possible to reach out to either the CMOs or the fee-for-service providers? Because when we check in GAMIS, a lot of our patients have a different address in GAMIS than we know, than they've given us.
Yeah.
Just a suggestion.
Yes. So we are utilizing addresses from our care management organizations. So we're doing a couple of things. We're using as our first contact the address and information that's in the gateway system. We are also utilizing addresses from our care management organizations. So we're developing a process whereby we will be able to extract that contact information from our care management organizations and send that into Gateway. We are also looking at return addresses. So when we get return mail back, we can look to see if there's a forwarding address as well. And we're also linking into the National Change of Address database. So we've got a number of avenues that we're plugged into in order to get addresses. But I want to also just highlight the necessity to utilize means other than mail, right? Okay, so text messaging is also another avenue that we're going to take, and emails. So yes, we've got a number of sources that we're utilizing to verify and confirm addresses.
That's great. Thank you.
And we have a couple more in the Q&A box.
Okay.
The first one she put, it was listed twice. I think I may be able to interpret what she meant by that. It says, my question is referring to pathways in regards to dental coverage for adults. Will there be like any additional dental coverage under the pathways program?
Sure. So as it stands today, dental services for adults are not covered in the Georgia Medicaid program. Now, there are some discussions that are occurring. There are some proposals on the table regarding adult dental services. But for the CMOs, they do all provide some variation of dental services for adults through their value-added benefits. And so as Pathways members enroll in managed care, they will be able to utilize those same value-added benefits as every other Medicaid member. So to the extent that that CMO offers adult dental services, that Pathways member will be able to take advantage of those.
Okay, and Michael Wright has one also in the Q&A. It says, who can we send a list of members that have lost coverage?
How do you want to handle that, Talisha? We can.
Send us some news.
Yeah, where do they send them?
Steve is one that does go via the eligibility renewal. They send a list of members. What was the question?
Where can they send a list of members? And that provider relations representative will then get it to us and we can do the research. Okay. So you all will need to send that to your provider relations representative, and that representative can then get that over to us. So plug into your, again, provider representative, and then they can get that information over to us.
Ralph, do you have another question? You still have your hand up?
I'm sorry, I'm on my phone and I can't put my hand down.
Oh, okay, no worries. Thank you.
No worries. All right, so we're going to check to see if there are any other questions in the chat, or does anyone else have any other questions that they'd like to ask at this time? Do we see any others?
There's a new post right now from Carissa Rogers. Who do we contact if we want to schedule a meeting for a large provider network?
At your provider representative, and then they will work with us to coordinate.
And right now we're all clear on the chat and there's no hands up. Actually, there is one hand up. Yeah, there is one from Adrian David. Adrian, you can go ahead and go with your question. Yeah, you should be able to unmute yourself, Adrian, if you'd like. And if you have an issue with using a mic or you're unable to speak, just feel free to post your question in the Q&A box as well.
Okay, so we do have another question from Diana Watkins. Will there ever be an option for providers to update the patient information on GAMIS?
GAMIS website, we are looking at some potential options in which providers can update member addresses on the gateway system. So that's something that we're exploring right now with DFACS. We've not come up with a solution at this point, but it is something that we're working on and we're looking at. If we get to a point where we can make that available to providers, then we will definitely notify you all via banner message, and we'll also add it to our frequently asked questions. But that's a very good question and one that we've discussed internally. It would be great if when a member presents to your facility, if you all could go in and update that information. So that's something that we're looking at right now. Very good question. Right. So we don't see any other questions in the Q&A or any other hands raised. So with that stated, this concludes today's Medicaid Fair. I want to thank each and every one of you for your attendance. I do hope that you found the information today to be informative. We encourage you to respond to any surveys that you receive regarding the Medicaid Fair. We hope to see you in person in the fall of the year at the upcoming Medicaid Fair. And in closing out, we thank you for your participation in the Medicaid and Peach Care for Kids program. Thank you. And again, on behalf of Commissioner Kaylee Noggle, have a wonderful afternoon. Thank you.